Hi, I'm Paula Diehr. I am, as of last month, an Emeritus Professor of Biostatistics and Health Services. You asked me to say a few words about how I got to this exalted position. My family moved to Los Angeles from Wisconsin in about 1949, and I went to college there. I was kind of good in math and science, but I also liked English and languages. And the main reason I ended up going to a math and science major was that the Russians sent up Sputnik, which made us realize how Americans didn't know anything about math and science, didn't have any achievements. There was lots of scholarships for people who would go to school in the sciences. So that's what I ended up doing. Somehow I didn't do a very good search for colleges, and I never talked to my parents about where I was applying. And so when I was trying to decide sort of between Stanford and UCLA, my father said, wait, you've got to go to a small college. And the only small college I'd applied to was Harvey Mudd College, an almost brand new college of engineering and science. And it had math and science majors, but it didn't have any English or language. So that's why I ended up staying in science, pretty much. I went in thinking I would be a chem major because I had just adored my high school chemistry teacher. I realized later that I was just in it for the glassware, that I just adored test tubes and things. So after a while, I discovered I was really a klutz in labs, and the only major that was left to me, that if I didn't want to do any labs, was math. So that's how I became a mathematician. And I was able to take all my language and my literature classes and things because math didn't take as much time because of the labs. So that's not a real strong motivation, but that's really how it worked out. When I was a senior, I took this one-year class in probability and statistics, and I just fell in love with it. It was really a wonderful topic. After I got out of college, I worked for a couple of years as a scientific programmer. Never learned that in college. Computers were just really coming in then. And ended up, my first husband went to UCLA to get an MBA, and so he looked like he was having such a good time that I joined him, and I was getting a master's in math because UCLA didn't have a statistics program. But then somebody told me about this new thing that was going on called Biostatistics. I had never heard of it, but I thought, oh, it sounds like statistics. So I walked down across campus and went from this very nice mathematics department to this really scroungy old brick building on campus. And out in front of this building, there was a sign that I swear, I kid you not, said School of Pubic Health. Well, this was a bad start. And I went into this thing, and it had condoms on the wall. I mean, it really was such a step down in my thoughts from math that I was really embarrassed for the longest time to tell anybody that I was in the School of Public Health. I kept telling them I was still in math. But I did go in and find the Biostatistics department, and they amazingly took me in. This was partway through second semester, okay, and they let me transfer in. It was just remarkable, and that's just how desperate they were for students because it was a very new program there. There's a history here of going to new things, and it's always worked out well for me to go to new schools and new programs. So I was there getting my master's at UCLA, and then even though I came in second semester, so I had to do, after the second semester, I had to go back and do the first semester, and then I was going to get my master's. Well, right then, UCLA switched from the semester system to the quarter system. And one of the classes that I needed to finish up was going to be a whole year away. So while I was waiting for this class, I got a PhD. It was not really my plan ever. Things happened, and I had a baby, and my husband got a job up here in Seattle, and I hadn't really even started my dissertation. But UCLA was very supportive and kept me on as a full-time student at UCLA, even though I was living up here. And so I would work on my dissertation up here. And after a while, they thought maybe I wasn't making progress. So they said, oh, one more quarter and that's it. So I decided I better look for a job. And I was thinking that it really was a job I was looking for, not a career. I was just looking for a way to make some money. So here I was in Seattle, and so I looked around. I sent letters to all the colleges, and Seattle U actually interviewed me. They were looking for someone to teach statistics, but in the end, they decided to go with somebody who already had finished his degree, and I had not finished yet. So they offered me some night teaching, and I didn't know what to do. The other approach I did was to look up Dick Cronmall. Dick Cronmall I hadn't known, but he was actually a UCLA graduate as well. And Dick told me, oh, the way to get in to know people is just kind of come to the seminars and make comments and get to know people, and then things come up and people will think of you. So I did that, and I came and I met people, and I gave a seminar, and I remember one time on a particularly nice day, I took my baby up in a stroller and wheeled up to the campus and protested the Vietnam War. And it turned out there were a lot of the UW Biostat graduate students there too, so I was able to socialize with them a little bit. And I also talked to Ed Perrin, who was then the chairman of Biostatistics, about that I was interested in looking for work. Anyway, this did finally pay off, that Donovan called me up one day, Donovan Thompson, and said he knew of a project that was looking for a statistician. Would I be interested? And I said, oh, absolutely. So I went and talked to them, and it was sort of, as I realize now, sort of a master's level job. And I said, oh, yes, I'd be happy to do this. And then the funding didn't come through, and I was very disappointed in this. But I called Donovan back and just told him that. And he said, well, why don't you come and talk to me? And it turns out that there was a new research program going on between Biostat and Health Services. We used to call it the Model Cities Project. It was basically trying to evaluate a program that provided free health care for people in the Central District here in Seattle. And in addition, Donovan was the principal investigator for a new training grant for people in biostatistics and health services. So they hired me because they needed both of these things filled. And that's how I became a health services researcher. I truly didn't know much about it up until that point. Oh, it turns out that my background was actually pretty good in that. I didn't have much bio background, but I did have a fair amount of social science and economics, and so operations research and things, which turned out to be a good thing for me. But it was totally a coincidence. So they hired me, and I don't remember what position they actually offered me, but after they got my letters of recommendation and things, they discovered that I was very close to finishing my dissertation. And Ed Perrin, bless his heart, said, well, we've got to make sure she has a faculty appointment in that case. So I was put on as an instructor rather than as whatever that initial position had been. And then later on, I was assistant professor, associate professor, et cetera. And it's really interesting how different things were. There was certainly no national search for this position. I got this position because I was there, and I had hung out at the end, met people, and that's exactly the way it worked. There's no way to get a job like that in a school like the University of Washington anymore, but it certainly was lucky for me that that's the way things worked out. I hadn't quite finished my dissertation, so one of the first things I had to do when I got this job was finish my dissertation. At that time, it was kind of hard to get scientific things typed up. And I had hired a woman who had formerly been a scientific typist at Boeing. And she was able to do this very nice work, and she had all these little nifty things where you could paste on an integral sign or something like that. And it looked very nice. And in fact, because Pat Wall and Dave Hosmer, who were students then, were finishing up about the same time I was, they used the same typist. Pat Wall was so worried about her dissertation burning up or something that she kept it in the refrigerator. And what it did was make all those little paste-ons curl up. So she had extra curly integral signs in her dissertation. Things are a little different now. The faculty then, it was a really small department. As I said, Ed was the chair, and he was only there for about a year. Then he moved on to join the National Center for, direct the National Center for Health Statistics. So Polly was the interim chair for a little while, then Donovan became the chair, then Polly was the interim chair a little while longer, and Tom Fleming became the chair, then, Norm became the chair, then Tom Fleming became the chair, and now Bruce Weir is the chair. So we haven't had a lot of chairs in the history of this department. I think I must have been on all of the search committees for all of them, and so I got to go out to dinner with all these people. It was really always very fun. And the different chairs would have different styles. So many people have talked about how wonderful Donovan was, and as you can tell, he's obviously made a big difference to my career as well. But I thought I'd mention Ed Perrin a little more. Ed was actually the founding chair of Biostatistics, and so he was actually in the medical school in the community medicine department, and Biostatistics was just a division in that department. And so when they all made up the School of Public Health, then basically all the divisions became departments in the new school. And so Ed became the chair of Biostatistics. And he said that one of the first things he did, he came in as a biostatistician, as an assistant professor. First thing he did was hired a full professor, and that was Donovan Thompson, because he had known him when they were both back at Pittsburgh. I started on the faculty in 1970, and I believe I was the first new hire of the new School of Public Health. They were just moving into their new offices the day that I moved in. I had an office on the third floor. I shared an office with Polly Feigl for a while. Then after a while, I started borrowing an office in environmental health, which meant that I was in a different office. And so if anyone called to the biostatic switchboard, somebody would have to come and get me. And I would have to come into biostatistics and answer the phone. It was not very convenient, but Ed Perrin was always worried that if I asked to have a phone in that office, they would notice I was there. And it was really an environmental health office. And so we went along like this for quite a while. It was quite fun. Other faculty then were, well, Donovan is everybody's father figure who made a huge difference to me. Dick Cronwall, who I've already mentioned, who told me how to get a job in biostatistics. Dick was the wild computer guy. Back then, there was essentially no statistical software. There were some great big things that ran hugely slowly on the mainframes. And when I say hugely slowly, when I was at UCLA, I would take this giant, well, sometimes two giant box of IBM cards, and I'd have to walk all the way across campus to get to the computer center. I was hugely pregnant at the time. These things weighed a lot. And I would take them in there, and 3 days later, I would get my output. And then there would be a mistake, of course, and so I would have to go for another 3 days and another walk up and down. I was certainly very fit at that time because I had to carry those boxes around so much. Anyway, Dick got very interested in developing a system that was especially good for medical data and would run on a mini computer. Now, a mini computer was size of 2 refrigerators. It was not very mini, but compared to the giant mainframes they had, it was really quite nice. I was a big fan of this, and I used it for quite a while. It was a real problem for me one time. My very first really big project, I decided, well, of course, we'll run it on CCSS, Conversational Computer Statistical System, I think is what it stood for. And so what I had to do was get all this data from this project. It was it was getting data from group health, which was, we had somebody coding up medical records. but Blue Cross Blue Shield, I think it was maybe called King County Medical, we got the data that every time anybody made a claim of any type, had any kind of a service, they would punch out an IBM card and mail it to me. And so after a while, we had rooms full of these cards, and we'd try to get them on this little mini computer, and we'd just about get them on there. And then what would happen is Dick would decide we need a new computer. Well, nothing ever was the same on a new computer. So we'd have to take all these, rooms full of cards and read them, back into this new computer. Around that time, they had removable disk drives, which were, let's say, this big, and this tall. And so I would have all my data on one of these removable disk drives. Well, this, of course, didn't work on the next computer that Dick bought. So we had to keep redoing this. So at one point, basically, Dick's people threatened me that if I added one more piece of data to this hard drive, to this disk, that they were not going to be responsible for it. So I had to go out and buy a second disk, and then my data were always in two parts, and the computer was never big enough to put all the data together. It really took an awful lot of cleverness to get anything done in those days. Paula Diehr was absolutely my inspiration in everything. As I said, I shared an office with her. She was the only woman there. Before her, there'd been a woman named Ethel Gilbert who left to go to Eastern Washington. Polly claims that she came in to take the women's position here, the women's slot. Polly was very interested in consulting, and so because I shared an office with her, I got to listen to her do consulting. And I just couldn't believe her approach, how she was so non-threatening, how she really made people think that they were smart and she was not smart, and really got their, really was able to help them. Whereas I, just coming out of sort of a math department, would just say, "What do you mean, are you stupid?" Well, I didn't say that, but I was, of course, thinking things like that all the time. Norm Breslow was on the faculty, but I think he was on leave the year I arrived, so I didn't get to know him as well right then. Ed, as I said, I didn't get to know until he came back, because he later came back after he left National Center for Health Statistics. He went to Battelle for a while, and then he interestingly came back to the Department of Health Services as the chair, my other department. One of the things that Ed did when he came back as the chair of the Department of Health Services. Number one, I was on that search committee, because I'm always on these search committees. Ed started trying to get me to come and be jointly in the Department of Health Services. So that's why I became joint in Health Services, because Ed really wanted me to do that. And that's turned out to work extremely well for me. You might just say, well, people in Biostat don't know what I'm doing, but they probably think I'm doing something great in health services, and maybe vice versa. And who knows, maybe I'm shopping at Nordstrom's or something. And so it's really very, very nice to have multiple responsibilities. I always found that nobody in the world knew what I was doing in biostatistics, but lots of times people would understand what I was doing in health services. In fact, in 1970, when I just started on that Model Cities project, we were trying to compare group health to Blue Cross Blue Shield in terms of quality and cost and maybe even satisfaction way back then. We were told, I was told at this time, that that was because we were about to have universal health insurance. This is in 1970. Now, I believe this was not even the Clinton one, right? This might have been Jimmy Carter or Nixon, for all I know. So I've been around on this a few times, and boy, I sure hope it works this time. Later on, as I said, we had one woman in the department, and then it became two because I joined, so Paula and Polly. And then Pat Wall finished her degree and joined the department working on the big lipid project. And then we hired another woman statistician named Paula Canarick. And so we ended up having Paula, Polly, and Pat. It was very nice because none of the students could tell us apart. And nowadays we talk to, somebody will come up and say, "Oh, you taught me biostatistics." And I say, "Oh, no, that was probably the other Paula, the other Polly, the other Pat. You know, we really enjoyed confusing people that way. Paula Konerik did leave, and she went down to Hewlett-Packard in Oregon when she got married. The training grant was great fun. I eventually became the principal investigator for the training grant, and it was for students who would be trained in both biostatistics and health services with the idea that they would go work in this area. One of the students actually, after she got her master's degree, many years later, came back and was my first doctoral student in health services, Andrew Leith. So this was half of what I was doing. The other half was this Model Cities project. And basically I just kind of came into this not really knowing what I was supposed to do. So I just took care of all the computing parts, and I was going to do the analysis when it came up. And I had been told, they were going to write a lot of papers, and I would, of course, be an author on all these papers. And I thought, that's nice. Well, it turns out that all the senior people kind of moved on to other projects. This is a long study. They all kind of moved on. Nobody wrote anything. And finally it turned out I had to write papers in addition to all of this, going crazy with the computing stuff. Well, at the time, this seemed like a bad deal. But in fact, it turns out that after a long time, I learned how to write scientific papers, and I turned out to be kind of good at it. I used to be good in English, and I used to be a pretty good writer for personal essays, but scientific writing is really quite different. So once I finally learned to do that without being stultifyingly boring, I've kind of got the knack of that. And so that actually stood me in good stead. And a few of the Robert Wood Johnson scholars and some of the other junior faculty came in later and wanted to analyze this data, and so that was actually helpful to me. And I did finally get some publications out of this, but I understand the faculty was very worried about me, that I wasn't getting any publications and would never get promoted. Fortunately, back then, it wasn't the 7 years up or 5 years up or out, whatever it is now. You could be moved over into what they call the research track, which I thought was funny because they moved me over to the research track because I wasn't doing any research. So I sat there for a couple of years till the publications finally came through, and then I got back on the regular track, and things have gone very well for me ever since that. I eventually ended up being a tenured professor in biostat and health services, but it's because our school required you to come up with at least half of your own money all the time. It wasn't very easy for me to take advantage of that and go on sabbatical. So I never actually did go on sabbatical. One thing I did, though, was in 1975-76, I went as an IPA to the government in Washington, D.C. An IPA stands for Intergovernmental Personnel Act. It means nothing whatsoever. But what it really means is that one branch of government can loan people to the other, lend perhaps people to the other branches of the government. So the University of Washington lent me to this National Center for Health Services Research. That is now called ARC, but it changes names kind of pretty often. And because we were still in the middle of this Model Cities project, we negotiated a deal that I could spend half my time working on Model Cities, analyzing it, but although I'd be in Washington, D.C., and the other half the time I would be a project officer. So hugely interesting. I really got to sit in on study sections and find out how everything was actually working. And Ed Piran helped me, gave me some recommendations to get that connection. The being on study section was a huge benefit also, because you get to meet the important people and you get to review the grants and you really know what's going on in health services. There was one area that I really got very annoyed about because it was so bad statistically and so popular politically, let's say. And this was trying to show that we need healthcare reform because in Boston there are twice as many back surgeries per capita as there are in Hawaii, something like that. And therefore, one of those rates must be wrong. Therefore, we've got to reform one of them. and we don't know which. And statistically, this always annoyed me because, of course, if you line up the rates of back surgery in all the states in the country, there's always going to be a high one, there's always going to be a low one, and the methods of order statistics tell you that, in fact, the highest and the lowest are going to be really far apart, really very surprisingly far apart, even if there's no difference in their average rates at all. And so I used to complain about this a lot when I was reviewing grants. I was asked to then another time to review a paper that had to do with this variation analysis. And I guess I kind of shot off my mouth in this review because the editor asked me, didn't I want to write an editorial about it? And so I did. And this is my most famous editorial, because I proved definitely that the biggest is always bigger than the smallest. And somehow nobody had ever really thought about this. And I ended up getting a lot of questions from people who wanted to know, well, how should they analyze all this variation data? And I said, well, I don't know, who cares? But after a while, I finally said, well, I guess maybe I ought to spend some time thinking about ways to do it. And so I ended up writing a paper about this, and it turned out to be one of my greatest hits. In fact, although it was very hard to get published, it was very popular, and I won a prize for Paper of the Year on this area variation. And so it is, and then I went on to write some other papers that were related to this. And I was never quite in love with the problem, but being a biostatistician, I could kind of see that there was a need for somebody to write about this and try to find some better methods for working on it. This turns out to be, well, it's important even right now when people are talking about healthcare reform. They talk about a place called McAllen, Texas, where the costs per capita are huge compared to, say, Rochester, Minnesota. So it's the same kind of looking at the highest and the lowest, and not really necessarily finding out whether they are significantly different on a statistical basis, or just the highest is always bigger than the lowest. And this turns out to be relevant in other issues too, where we're trying to find the best hospital. Well, if it's hard to find the best state, believe me, it's much harder to find the best hospital because your numbers are so much smaller number of patients per hospital. And some people even want to try to find the best doctor. Well, the number of patients per doctor is tiny. There's really kind of a hopeless question, and yet there are so many people who want to do that to rate quality of providers and of hospitals. The nice thing about being in health services research is that it's basically all over Seattle. And over my career, and I've been here 39 years, I was just looking, and I noticed that not only have I worked with investigators at the University of Washington, but I've worked at the old public health hospital, that's now Amazon.com building, at the Fred Hutchinson Cancer Institute on a project with Polly Feigl. I worked with investigators at Group Health on a big evaluation of the Henry J. Kaiser Family Foundation Community Health Promotion Grants Program evaluation, that we worked on that. It was a surprising thing because it was an impossible design statistically. It was supposed to be a grassroots thing. So these communities were given money to try to improve the health of their communities. And half of them were given money and half of them were not. Well, there weren't very many. There were maybe 20 communities total. And the communities had to go through this process to decide what they were going to intervene on. And so we didn't even know at the beginning what we were supposed to measure in these communities to find out if they actually improved health in the communities. And so we just measured everything. This is under the leadership of Ed Wagner. It was just a fabulous thing. We ended up with this huge amount of data that we never used. In fact, tons of smoking data, and none of the communities decided to intervene on smoking, so we never really had to use it for that. But we were able to write, probably 10 papers about smoking. And although that was quite an old study, maybe early 1990, I'm still using that data today. I've got a paper under review right now that that uses some of that old smoking data. So it turned out to be an extremely good project, even though the thing we were trying to evaluate was not very successful, or we certainly couldn't show it was successful. Then I worked at the VA, mostly with Steve Finn, who'd been a Johnson Scholar, who I had worked with a little bit when he was at Public Health Hospital. And I just finished working with Steve in the last year. It's gone on for many years. And we were usually doing projects trying to improve health of people at the VA by either collecting more information about their health status and providing it to their providers in a good form, or by trying to use a team approach so that people with angina would be treated with the highest level of care. Neither case did we get a significant difference. Steve blames me for all of these things. Pat Wall and Dick Cronmall started up a project called the Cardiovascular Health Study, which has, I think it started in 1988 and is still going today with new grants coming in. But this is just a fabulous thing, and Pat talked me into coming into this because she thought I'd be interested because they had health status data, and that was something I was getting very interested in. And a fabulous thing because they had about 6,000 people, and they were all over 65, so they were followed for about 10 years. They're old people, so things happen to them. I am now in that age group, and it's really kind of a shock. But it's really really neat data from a statistician's point of view, because there's change over time. There's longitudinal data. At that time, nobody really knew much about what to do with longitudinal data. The methods for that have improved tremendously in this amount of time. But I'm finding that even finding a way to draw a picture of what's going on longitudinally is challenging, and I've really enjoyed that. What do you do with people who die? And it turns out that's a very big challenge too, and that's turned out to be one of my great interests. Approaches when you're following people over time. What do you do with people who die? You can read it in the papers. I won't tell you about it. And I worked with people in the public health department, which, including Mickey Eisenberg, and those mostly have to do with people with automated defibrillators. Lately, I've gotten into, well, as I say, I retired, and the latest unusual project I've gotten in for me is one with about social marketing, and I certainly never knew what social marketing was, but as it turns out, as I went to all these meetings about social marketing, and what is it? It's using marketing principles to increase the health of the public. Now, first of all, who knew there were principles in marketing? I certainly didn't. But at any rate, so I would kind of go to these meetings, sit around like a dummy. But after a while, I thought to myself, there's this theory over here, and there's this theory over there that's kind of related. And I have this smoking data that I got from this study 10, 15 years ago. And so I was able to put together a kind of cute paper about social marketing that proves that prevention is better than anything else with respect to smoking, if you have a public health goal. I'm very hopeful that's going to be published. It's in its second round of reviews right now. But the idea that as a math major that I was going to be writing papers about social marketing in my old age, it turned out to be very surprising for me. I feel in many ways that I've done my career a little backwards compared to other people in the department. I think that most biostatisticians start out writing very serious methods theory papers that they publish in Statistics Journal, and later on do more and more applied work. Perhaps start out applying their methods to real data, and then actually may even end up writing the actual applied papers. I actually started out writing applied papers and applying my methods to them a little later, and then lately I've been actually doing some statistics papers, always generated from the work I've been doing. One of the things I've been interested in is multi-state life table. Now that's sort of like a regular life table, only you divide the people who are alive up into several states, like healthy and sick. And that no matter where you start the population, suppose you have a population where everybody's healthy, population where everybody's sick, no matter where you start, eventually you end up where the prevalence of the healthy state is the same. And that's what I'm calling that the equilibrium prevalence. And my latest very exciting thing is I've been trying to understand this equilibrium prevalence a little better. And it turns out that the equilibrium prevalence is an eigenvector of the probability of the matrix of transition probabilities. I don't think you'll understand any more than that, but I'm just telling you that finding something from biostatistics that is absolutely a theory thing that turns out to have a practical application is really very, very exciting. I've spent almost all of my time as a professor. I've kind of taught 2 classes a year. In the beginning, always in biostatistics, later on, mostly in health services, and then the last few years, I've given up teaching. Most of the time, I've been doing applied research and writing papers. Part of a few times I had a break, and I got a little bit into administration. When Ed Perrin retired as the chair of health services, now this is the second time he's left the university, there was a search committee to find someone to replace him. And I expected that this one would take a long time because the previous search that had ended up hiring Ed had taken 2 years. So I said, okay, well, I would be acting chair of health services, and I had some sort of long-term ideas about what I would do there. Well, it turns out the search took only 3 months. They hired Bill Dowling almost immediately, and so I was actually not able to get very much done. The one thing that I did actually get done was install this horrendous point system, which I think has been the death of health services ever since, and I do hope to get rid of it, trying to figure out whether people were teaching enough to justify their salary or whether they were doing this and that enough. So that was about all I did. And so I thought the lesson that I learned there is to get in and do something fast. So a while later, the chair of pathobiology, another department in the school, stepped down, and Pat Wall, who was the associate dean, was asked by Gil Ullman, the dean, if Pat was asked to go and be the acting chair in pathobiology. Now, this is just a kick. She actually did a wonderful job, but of course, Pat is a biostatistician. She doesn't know anything about pathobiology. The faculty there asked me one time, they wanted to get her a little present, what should they get her, a nice book or something? And I said, why don't you get her a microscope? And so they did. They bought her a little toy microscope, and she was so pleased with it. I think she's still got it in her office now. I don't know if she knows which end to look in through. I certainly wouldn't, but it was really kind of fun. Anyway, since Pat was then busy off solving all the problems in pathobiology, she needed an interim acting chair. And she felt sorry for me that I hadn't gotten to be chair of health services very long, so she got me to come in here. And we thought this would be another 3-4 months thing, so I acted quickly, and I had a couple of things I wanted to get done, and I got them done. And then suddenly the thing went on for a year and a half. Truly, I don't remember a lot of what went on when I was the acting associate dean, and some of the things that I do remember I really couldn't talk about because they were personnel issues and things. One of the things that I did was help to organize the 25th celebration of the 25th anniversary of the school. Now we're at the 40th anniversary coming up. Time does fly. Other things that we did were starting up a public health genetics program and things, but basically all I did was Gil Ullman suggested that I do something, and I did it. And I didn't really feel that was my work, and I was kind of quite relieved when Pat came back, and I got to just go be a professor again. I think for the 25th anniversary, each department wrote an article about how things had changed in the 25 years, and I wrote one about computing. And one of the adorable things that we had was we had an IBM picture of an IBM card, which is about this big, and then said, and this would hold 80 characters. And then we showed, a little 2¼ inch floppy disk, which of course is much smaller and held, goodness knows, it seemed like a lot at the time. I think it would be fun to do that again because now we have these little thumb drives that you carry in your purse and have. Mine has 8 gigabytes in my purse, and I suspect I could afford even a bigger number if I had that much information. So it really is quite remarkable how things have changed, and we're certainly faster. I hope we're more productive. The kind of miss the old days though, where you actually had to go talk to people, and you stand around waiting for your output to come out, and you could help one another clear up the messes when the printer got jammed and things like that. And it was kind of a way of getting out of the office, getting a little exercise, getting a little sociability. And we don't have that now. We can just sit at our desks and not ever move again. Another big thing, though, that has changed over this time, of course, is the role of women. As I've mentioned, there was one woman in Biostat, and I actually did a calculation of this one time, and we went up from a small number to, we basically, for the last at least 20 years, been 50-50. That the faculty has been about 50-50, the students who are coming in are 50-50 or even a little more, that we tend to get maybe 60% women in Biostat. The stat department on upper campus tends to have more men. And I don't know if this is just a thing about women liking socially useful things more than techie things, and because they're socialized that way, I don't know. But it's certainly been nice. For me, it was wonderful coming and finding even one woman, Paula Diehr. The college I went to, Harvey Med College, well, there were only 2 women in my class. And in fact, I live at a women's college, at Scripps College, because there weren't dorms. And so, in fact, I had no science women to talk to. Scripps was a liberal arts college, and so there were no women I could talk to about math and science, really. And so coming here, I found I could talk to Polly, and as there were more and more people, there were lots of women I could talk to about things other than babies. This was just wonderful for me. And I really remember at a point, I guess I had a little party, a little pre-party before we went to a statistics meeting, and I just invited a bunch of women to come in and have a glass of wine before the meeting. And I said something like, when I was taking calculus, something or other, and everybody said, oh, yeah, that happened to me too. And I was just so thrilled that I could actually talk to women about some of the things that I was working on. I think this has just been a huge improvement for me, and I like to believe that it's improved public health and biostatistics as well. It's been interesting being in this school because there have been 4 deans. Tom Grayson was the dean, and then Bob Day took over from him, and he was the dean of the school until he left to head up the Hutch, the Fred Hutchinson Cancer Institute. And I didn't talk to him very much then. I remember him telling me I looked like a lemon one time when I walked in a yellow dress. That was about it. Oh, another dress story. Oh, 2 more dress stories. Oh, golly. I was at the Hutch, and I was working with Paula Diehr, and we discovered that, unbeknownst to us, we had each bought the same dress, only mine was pink and hers was yellow. And so we were writing up this giant progress report, and I wrote one chapter, and she wrote another chapter, and they were bound, and mine was bound in pink, and hers were bound in yellow. It was so great. So we had a nice picture of us taken with our color-coordinated project reports. Another dress story was when I was the dean, acting associate dean, that I was invited to go to the medics graduation. And my big thing, what do I wear? And it was really hot, and so I had this kind of cool dress, but it was a little bit wrinkled. And then I had this other dress, which was very much nicer and not wrinkled, but would have been a little too warm. So I was torn between the two, and then I said to myself, well, they will, the dress I was thinking about wearing, by the way, was a silk thing with beautiful flowers on it. It was a really gorgeous dress and very striking. So, but I decided to wear the other one was a little bit wrinkled because I reasoned, oh, I'll just be sitting in the audience. Who's ever going to notice? Well, it turned out I had to sit on the stage, so everybody saw my wrinkles. And it turned out that Ruth Ballweg, who was the director of the medics program, was wearing the silk dress with all the flowers. If I had made that other decision, we would have been up there looking like a sister act. And we still, every time I see her on the elevator, we check out what we're wearing to make sure we're not wearing the same dresses. After that, Gil Oman came in. Gil was kind of a scary guy, just very, very intense and very excited and very into things and not always the most diplomatic. But he was actually wonderful to me. He read something that I'd written in the American Journal of Public Health, I guess, and he wrote me a note, a nice handwritten note about how much he'd liked it. And I just thought that was so terrific. So people have many, many skills, and he was extremely smart and driven and intensely interested in the politics of the situation. Then when Gil left to go to Michigan, I was, of course, on the search committee that ended up hiring Pat, and she was wonderful. She just knows so much about everything, and she cares so much about the school. It really is a wonderful thing. She's also a very dear friend, but I would say good things about her, even if she were my enemy, that she is really a fabulous dean for the school. And it's in some ways too bad that she doesn't teach anymore. She was really a terrific teacher in biostat, and she's stepping down at the end of the year, and maybe she'll go back and start teaching in biostat again, and I think that would be a real benefit for all of the students. I think that things are quite different now than they were when I started out. The way to get a job is certainly much harder. It's harder to get money. It just seems harder in a lot of ways. But obviously, public health is hugely important, and the research we're doing is very important, and I guess we just have to work hard. We just do that. I'm hoping that this third time around that healthcare reform and universal health insurance is going to come through, and I'm happy to have had some part in some of that research. Being a biostatistician really gives you tools to be a researcher in another area, and I hadn't really known that. But I really think of myself as a health services researcher as well as a biostatistician, and I have had my own lines of interest in things that I've studied up that have just been my research, and I'm really very pleased with those. I think people are sometimes worried about being in something like a joint position because they feel that there'll be too many demands on them in both areas. I've found what's neat about being in a joint position, and especially in a fairly new area that doesn't have a lot of biostatisticians, is that a lot of the easy stuff hasn't been done yet. And you can actually write some biostat papers that don't require huge amounts of theory, that just require the basic kind of knowledge that we all have as a statistician. And so it's a real. I would certainly encourage people to consider getting into new areas, consider joint degrees, certainly consider the School of Pubic Health.